This is a much watched video if you have a hiatal hernia. So a hiatal hernia is where the diaphragm becomes either lax or the stomach protrudes up towards the esophagus, or the esophagus at the distal end before it drops down below the diaphragm becomes distended. So the hiatal hernia is some degree of dysfunction happening right at that esophageal diaphragm junction and where the stomach and duodenal junction happens. And so there's usually a weakness in that area. Now, a couple things you can do in order to help this hiatal hernia and help mitigate symptoms naturally without surgery. A lot of surgeons don't like to do hiatal surgeries and they'll just prescribe like antacids in order to help manage the symptoms, but this can be really uncomfortable. So one of the great things that you can do when you have a hiatal hernia are three things. First, you can learn how to do diaphragmatic breathing to help strengthen your diaphragm. Second, you can do hypopressive exercises in order to help strengthen your diaphragm. Third, you can work on managing your intra-abdominal pressure by doing visceral manipulation on yourself or visceral mobilization. And that means you can get your organs actually moving better so that they can move and ebb and flow in your body so they're not as stuck. This gives the room for the stomach to also move better and help decrease some of that pressure up on that esophagus so that hiatal hernia isn't so stressed out. So managing intra-abdominal pressure can be a really important facet in helping manage hiatal hernia pain. So if you have a hiatal hernia, you either experience indigestion or discomfort right in this area of the abdominal wall. So as that esophagus comes down through the diaphragm lives underneath the rib cage. When you take a nice deep breath into your belly, like this, that is called a diaphragmatic breath. Now you can also do a diaphragmatic breath with intercostal expansion. So what that looks like is you take a nice deep breath into your belly, fill it as much as you can, and now try to breathe into your rib cage. And that's gonna help get your diaphragm as elongated as possible. And then you exhale the air and let it go. This is a great 5-minute exercise to do every single day. Just take these deep breaths, go at your own pace, and use your diaphragm intentionally at max capacity to get full elongation. And that will help give a little bit of a pull on that bottom of the esophagus where you experience that hiatal hernia. So this is one of my favorite things to do. So again, what that move is you breathe into belly, so breathe into belly, then you breathe into your rib cage, and then you exhale and let it go. If any of those parts of that breath pattern are too uncomfortable, then just do the piece that is not uncomfortable and doesn't exacerbate your symptoms. If any of this exacerbates your symptoms, you should absolutely work with a pelvic floor physical therapist, someone who can help decrease your hiatal hernia pain. Okay, so that is how to fully maximize the use of your diaphragm to give a little stretch on the bottom of the esophagus, helping reduce that hiatal hernia. The second thing you can do is you can do what's called a hypopressive or low pressure exercise, also known in the bodybuilding world as an abdominal vacuum. I love to do these because these help create a negative pressure within the context of your abdomen. And also, if you put sensors intrarectally or intravaginally and you do a hypopressive, you actually decrease the pressure. It's the only exercises that decrease intra-abdominal pressure and actually can create negative pressure within the cavities themselves. So it's a pretty cool exercise. Follow along here. This is how it's performed. And what most people don't know is this is a completely passive exercise. So you're not trying to tighten your core muscles as you're doing this exercise. You're simply creating negative pressure and creating a vacuum effect. Now, if this increases the symptoms of your hiatal hernia, you would not do it. You're only going to do this if it actually is helpful for you. For some people, they actually find that this negative pressure helps reduce the tension on that hiatal hernia. So what this looks like is you put your hands on your rib cage, you take a nice deep breath into your rib cage, so you breathe into your rib cage, you exhale all the air, you get the air out of your lungs as much as humanly possible. There's always a little bit of residual volume. Then you pretend like you're sucking up a straw and you go into the vacuum. And then I fill my lungs back up. So you saw me create that suction effect where the diaphragm, when I'm fully deflated, there's no air in my lungs, and then at the end of the exhale, I suction the diaphragm up along with the organs and create that negative pressure. So here's what it looks like. Again, I'll show you with my little midriff showing here. So you're gonna go here, you're gonna deep breath into the ribs, exhale all the air at the bottom of the exhale. Then you go into the vacuum where you suck that diaphragm up underneath your ribs. So you close your glottis in your throat. No air should be able to get in or get out. You're not inhaling to create that suction effect. You fully exhaled and then you create the suction. This will help you manage that hiatal hernia pain. Now, I know that exercise takes skill, it takes work, but go study. I have a couple hypopressive videos that we'll link to the end of this. Go study those hypopressive videos and start to do some hypopressive. It's also great for core strengthening. It's great for if you just had a baby. It can be really nice to utilize this in any management of pelvic pain, low back pain, urinary incontinence, or pelvic organ prolapse. So go do these hypopressives. You will find them very beneficial at managing your hiatal hernia, but also all those other pelvic dysfunctions. Okay, last but not least, this is called visceral manipulation or visceral mobilization. I was trained by the Barral Institute, and I learned my visceral manipulation through them. But essentially, what you need to know is that all the organs in your body, they ebb and flow. They move in what's called inspire and expire. So they move away from your midline and back towards midline, independent of your actual inhalation and exhalation. And so they just move in your body. Now, a lot of times we get frozen. We get frozen in our guts due to stress, due to an abdominal surgery, due to constipation, due to a virus, anything like that. So we want to get those guts moving as much as possible. The more that our guts move, the decreased abdominal pressure that we have. Now, if we have decreased abdominal pressure, that can help improve the stress that's put up on that hiatal hernia. And so getting those organs moving is really important. So having good bowel movements, peristalsis, so how the colon moves the poop in your body, is also really important. So doing whatever you can to regulate your bowel movements will help manage your intra-abdominal pressure, which will help manage your hiatal hernia. And so here's what we're gonna do. We're gonna move our organs around a bit. So this might be reversed on the screen, but essentially your stomach is on your left side of your body. It comes down through the esophagus, and then you have your diaphragm, and then you get the duodenal junction, and it matches up with the duodenum in the stomach, okay? So here's your stomach, where about a stomach goes. You need that stomach to be able to move in your body. Now there's this little part that creates a loop right here. So as your esophagus comes down into your body and goes into your stomach, there is this kink. What people find very helpful is moving that kink towards the right side of their body. And so what I love to do is I love to stick a piece, if you're having hiatal hernia symptoms, and they're really bad, sticking a piece of tape going from the top of your left shoulder, that's the angle, down towards your right hip, increasing the duodenal junction angle. And so here's what that looks like. I take a piece of KT tape about this big, Kinesio tape. We can link our storefront in the bio, and you can buy the KT tape that we use. We go skin to skin with this. So I come right underneath my left breast, and I am going from my left shoulder, the angle down. I'm going to take that duodenal juncture and I'm pushing it down right here, angling it towards my right hip. So I'm just helping facilitate a little bit of an increase in the angle of that junction. And now you can rub it in this direction as well, and that can help pull that hiatal hernia down and decrease some of the pressure on that hernia. And so what we want to do is increase the visceral mobility of the organs. The more we can increase the mobility of how these organs move in your body, again, the decrease we're gonna have in intra-abdominal pressure, and the better that we will be managing the symptoms of our hiatal hernia. Now, one of my favorite activities to help manage the intra-abdominal pressure and regulate the bowel movements is the colon massage. We can link a video to me fully demonstrating the colon massage at the end of this video, but essentially what you do is you lay on your back, your abs have to be fully relaxed. You start at the bottom of the right hip, and so at the bottom of the right abdomen, and you are on your cecum, it's called. You go in a clockwise fashion and you work your way around your entire colon. Now I'm going up into my ascending colon, working my way around through my transverse colon, and I'm coming to my left transverse colon. Now I'm going to go down into my descending colon, and again, you can just go fingertips together or you can go fingertips on top of each other, and I'm working it down, 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 and going all the way down into cecum and rectum here. And so when I do that, that will help me stimulate normal peristalsis and get a little bit more mobility within the colon itself. All right, these are my tips for you to help manage your hiatal hernia. Working with a pelvic expert physical therapist can absolutely help you maintain and improve your intra-abdominal pressure, taking pressure off that hiatal hernia. If you imagine that your entirety of your core is a balloon and you have a tight pelvic floor or something in your body is tight here, you're gonna have more restrictions and you're gonna have more upward pressure of that hiatal hernia. So getting your pressure in order is gonna be probably the best thing you ever do for that hiatal hernia. Again, surgery should be the last resort. I understand it's needed for some people, but also surgeons don't love to do this type of surgery. So I hope you don't have to rely on antacids and you can use these tools to help manage your hiatal hernia naturally without medication or surgery. I'm Dr. Allison Felt. Please like and subscribe. Send this to all your friends that are taking antacids and having difficulty managing their hiatal hernias.